Brain health refers to the state of brain functioning in various domains, enabling individuals to reach their full potential throughout their life. Factors such as physical health, healthy environments, safety, lifelong learning, social connection, and access to quality services influence brain development, adaptation, and response to stress. Addressing these determinants improves mental and physical health, creates positive social and economic impacts, and advances society. However, conditions affecting the brain and nervous system, such as congenital and neurodevelopmental conditions and neurological disorders, emerge throughout life and disrupt brain growth, structure, and functioning, although it's not an inevitable consequence. Experts emphasize the importance of maintaining brain health at every stage of life. Maintaining healthy habits not only reduces the risk of Alzheimer's disease and dementia but also preserves independence, improves quality of life, and promotes overall well-being and longevity. This video will provide various possible strategies to help maintain brain function. 12 useful tips you need to know to keep your aging brain healthy. Better brain health while aging. Regular physical activity benefits not only the heart, muscles, and bones but also the brain, aiding in thinking, learning, problem-solving, emotional balance, memory improvement, and reducing anxiety or depression. It also reduces the risk of cognitive decline, including dementia, and improves sleep and overall well-being. Inactive adults are nearly twice as likely to experience cognitive decline. Furthermore, regular physical activity can reduce the risk of certain cancers and extend life. Regular exercise benefits the mind by increasing the number of blood vessels that bring oxygen-rich blood to the brain's region responsible for thought. Exercise also stimulates the development of new nerve cells and increases connections between brain cells, leading to more efficient, plastic, and adaptive brains. This results in better performance in aging animals. Exercise also lowers blood pressure, improves cholesterol levels, helps blood sugar balance, and reduces mental stress, benefiting both the brain and heart. All adults require muscle strengthening activities 2 or more days a week, while adults 65 and older require balance activities about 3 days a week. The brain contains 50 to 60% lipids, with 35% consisting of omega-3 PUFAs, with DHA accounting for over 40% of total omega-3 PUFAs in neuronal tissue, particularly in gray matter. Omega-3 is a crucial nutrient that enhances cognition, preserves neurons, and safeguards against neurodegeneration. The Mediterranean diet, which consists of plant-based foods, whole grains, fish, and healthy fats like olive oil rich in omega-3 fatty acids, has been linked to reduced Alzheimer's disease risk. This diet, which is lower in red meat and salt compared to the typical American diet, is essential for cell function, reducing the risk of coronary artery disease, increasing mental focus, and slowing cognitive decline in older adults. Further research is needed to determine the most beneficial parts of the diet for brain function. The brain is just like a muscle that needs to be used or lost. To maintain its health, engage in activities like crossword puzzles, reading, playing cards, or jigsaw puzzles. However, healthcare teams often avoid paid brain training programs as they often overstate results or focus on memorization skills. Reading and puzzle-challenging activities can provide the same brain workout. Additionally, avoid excessive TV viewing as it is passive and does not stimulate the brain effectively. Social interaction prevents depression and stress, which can lead to memory loss. Connect with loved ones, especially if living alone, to avoid brain atrophy. Social activity strengthens brain health, as research shows solitary confinement can lead to brain atrophy. Social networks and activities enhance cognitive function, keep the mind agile, and can prevent mental decline and reduce the risk of dementia by promoting socialization. Blood pressure is the vital force that propels oxygen-rich blood throughout the body, generated by the heart and distributed through arteries, which transport and distribute blood. Blood pressure is influenced by various genetic, hormonal, metabolic, neurological, psychological, and lifestyle factors in the heart and arteries, causing it to fluctuate minutely and hourly throughout the day due to these complex influences. Normal blood pressure in adults is below 120/80. While the latest guidelines classify elevated blood pressure, hypertension, as having a systolic blood pressure between 120 and 129. Hypertension, which damages blood vessels, contributes to vascular dementia and Alzheimer's disease. Research suggests that vascular damage and tissue inflammation accelerate injury. High blood pressure increases the risk of mild cognitive impairment, vascular dementia, and Alzheimer's disease. Both systolic and diastolic hypertension take a toll, with higher pressure and longer persistence without treatment increasing the risk. Italian scientists found that treating hypertension can reduce the risk of Alzheimer's in patients with mild cognitive dysfunction, with antihypertensive medications 80% less likely to progress to full-blown Alzheimer's than untreated patients. Maintaining a healthy blood sugar level is crucial for managing diabetes and preventing complications like heart disease and vision loss. However, episodes of high and low blood sugar can impact brain function due to the brain's sensitivity to sugar intake. The brain, composed of nerve cells, is the body's command center, controlling our emotions, learning, and memory. It uses half of the body's sugar energy to function properly, making it the most energy-demanding organ, requiring half of all sugar energy in the body. Blood sugar levels can disrupt the body's balance, causing nerve damage to the eyes, feet, and hands, as well as brain damage. This can lead to memory and learning issues, mood shifts, weight gain, hormonal changes, and Alzheimer's disease. It's crucial for people with diabetes to maintain their blood sugar levels at target levels to avoid these harmful effects. Over time, high blood sugar damages brain blood vessels, leading to brain atrophy and brain cell death. This can cause memory and thinking issues, potentially causing vascular dementia. Hypoglycemia, or low blood sugar, occurs when blood sugar levels drop below 70 mg per deciliter and can be dangerous if left untreated. The brain shuts down oxygen due to insufficient sugar supply. Symptoms include dizziness, shakiness, irritability, difficulty walking or talking, and severe low blood sugar can cause death, seizures, or even coma. Research indicates that significant drops in blood sugar levels may be linked to issues with depression, memory, and attention span. High cholesterol levels may be linked to Alzheimer's disease or other types of dementia, although evidence is limited, and heart disease is often associated with high cholesterol levels. The exact cause of Alzheimer's disease remains unknown, but amyloid plaques, found in Alzheimer's patients' brains, may be involved, possibly due to the accumulation of beta-amyloid protein, which may be influenced by cholesterol. The study revealed a correlation between higher levels of LDL cholesterol and lower levels of HDL cholesterol and increased amyloid in the brain. High LDL levels in the brain decrease blood flow and can cause white matter hyperintensity, affecting cognitive performance due to the breakdown of white matter's vital function. Water accounts for 75% of brain mass. Dehydration or lack of water can negatively impact cognitive function. A 2023 study found that dehydration reduced cognitive function in overweight adults. A recent poll found that 25% of U.S. adults drink 1 or 2 glasses of water daily, while 8% rarely or never drink it. The National Academy of Medicine recommends 9 glasses of water per day for women and 13 glasses for men, based on the recommended daily intake. Sleep is crucial for brain health, as it feeds the brain and aids in memory processing and storage. Poor sleep can significantly affect brain health, especially in patients working nights, who experience brain fog due to working against their biological clock. Doctors recommend aiming for 7 to 9 hours of quality sleep each night, establishing a regular sleep schedule, creating a relaxing bedtime routine, and ensuring a comfortable sleep environment. Stress negatively impacts the brain and other body parts, and can be reduced through physical activity, sleep, relaxation exercises, and mental health support. However, if stress still affects memory and attention, it's essential to seek professional help, such as therapy or medication, to improve brain function. Most of the doctors recommend aiming for 7 to 9 hours of quality sleep each night, which will help the brain function better during stressful times. A study by Washington University School of Medicine in St. Louis reveals that smoking shrinks the brain, and while quitting smoking prevents further loss of brain tissue, it doesn't restore its original size. As individuals age, their brains naturally lose volume, but smoking accelerates the brain to age prematurely. Quitting smoking is a modifiable risk factor that can help prevent brain aging and decrease the risk of dementia. Alcohol after intake quickly enters the body through the stomach lining, spreading into the bloodstream and tissues. It reaches the brain within 5 minutes and starts affecting within 10 minutes. Excessive drinking can lead to mental health issues like depression and anxiety, increase cancer risk, and cause severe brain damage. Wernicke-Korsakoff syndrome, WKS, a brain disorder caused by thiamine deficiency or vitamin B1 deficiency, partially due to chronic alcoholism and nutrient deficiency, can result in amnesia, confusion, and eyesight issues. Researchers from the University of Oxford discovered that the amount of shrinkage in the hippocampus, the brain area linked to memory and reasoning, was linked to the number of alcoholic drinks consumed. Those with 4 or more drinks had a 6-fold higher risk of hippocampal shrinkage, compared to non-drinkers. A recent British study suggests that even moderate drinking is linked to shrinkage in brain areas involved in cognition and learning. Maintaining brain health as you age is crucial for cognitive function and overall well-being. To achieve this, you should stay physically active, eat a brain-healthy diet, engage in mentally stimulating activities, get enough sleep, manage stress, stay socially connected, and keep learning. Regular exercise boosts blood flow to the brain, promotes the growth of new brain cells, and reduces the risk of cognitive decline. Eating a brain-healthy diet, including fruits, vegetables, whole grains, lean proteins, and healthy fats, is essential for brain health. Engaging in activities that stimulate the brain, such as puzzles, reading, and musical instruments, helps build cognitive reserve and protects against age-related decline. Staying socially connected with friends, family, and community members can help reduce the risk of cognitive decline and improve overall brain health. Lifelong learning is essential for maintaining cognitive function as you age, and challenging yourself with new activities can keep your brain active and engaged. To protect your head, take steps to prevent head injuries, limit alcohol consumption, quit smoking, manage chronic conditions like hypertension, diabetes, and high cholesterol, and cultivate a positive outlook, gratitude, and coping strategies. By incorporating these strategies into your lifestyle, you can promote brain health and maintain cognitive function as you age.